So yes, so we have, so in the context of the GEM2014 trial from the Spanish myeloma group, which is a trial investigating the use of maintenance in patients with myeloma, so we have analyzed and compared the results of MRD assessed in the bone marrow by next generation flow and in peripheral blood using mass spectrometry. And we have done this at the enrollment in the trial and after 2 years of maintenance. So basically what we have confirmed from previous studies is that the prognostic value of the assessment of MRD in peripheral blood using mass spec and of NGF to assess MRD in the marrow are comparable, I would say. And we have also confirmed that both techniques at this time point do not seem to have an additive value, a complementary value. And we have also confirmed, as expected, I would say that the maintenance, so that sustained MRD negativity, in this case for 2 years, is associated with a better outcome as compared to just to have a single time point being MRD negative, and this using both techniques, both NGF and mass spectrometry.